Cinemas the world.
All right, so okay, so there are several innovations, and I'll probably just quickly give you a quick overview of just the scale of the footprint, so that you have an appreciation of the background and the depth of the overall wellness and healthcare platform that we're riding on as we offer you the various offerings we have. Um, just to give you the overall coverage of the different points of value addition of a patient's journey. We're covering the funders like yourselves, the service providers. I'm assuming you're all looking at the same diagram that I'm showing here. Is that the case?
Yes.
Okay, perfect. So the funders are covered, service providers, the community, the patients, and the members for the funders. So basically the entire value chain or the patient's journey is covered by the whole platform, so that there's an entrance point for each caregiver or each participant in the value chain. So now, just to give you an idea of numbers, that you have an appreciation of the scale of our operations. So we have over 1,000 healthcare sites that some are utilizing our platforms, and we currently have over 2.5 million patient records. And this platform has been in live usage for over 10 years, and it's present in at least 3 countries. So that's just to give you a quick overview of just the scale of operations from a technical perspective. And I want to quickly go into an overview of the individual solutions themselves. So I will start with telemedicine, which obviously is a good solution to offer to your membership as a funder, as a medical aid. Basically, this enables your members to access your service providers, the service provider on your network. So I'll just show you a quick illustration of how it works. So this is actually a conversation happening between a doctor and a patient, and that conversation it involves exchange of voice, exchange of video, and eventually a prescription is given and a bill is provided. Obviously, there's a waiting list for the doctor, where the doctor picks a particular patient and converses with them and gives them service. Now, because this is happening on a platform that's run by the funder, it means that this whole conversation is not it's different from a social media platform. It is part of the offering of the healthcare funder, which means that all these conversations are part of the patient's electronic health record, and they're used to validate the claim that's eventually submitted by the doctor, because you have the first-hand proof that there actually is service that was offered. This, of course, beats any kind of fraud, because you directly can audit what actually happened between your member and the service provider. And you're also positioned in a place where you can protect your members from less than high quality service, or from anything not as good as industry best practices in terms of patient care. And you can also validate things like prescriptions, or the professionalism of the service providers that's being offered to your membership. You can also directly check that, say, for example, the prescriptions which are given are valid prescriptions. They're not just for the profit of the pharmacy. They're actually justified, because your own clinicians, your own adjudication team can actually interrogate the conversation that happened, what the challenge was for the patient, and what's the indicated form of care for the patient. So that's telemedicine. It's very powerful way of serving your membership and protecting your membership, and of course locking in your membership to yourselves, as they then have a very strong personal relationship with you as always their preferred funder or insurance. So that's telemedicine. And by the way, because it's a remote service, it is ideal for this time. It has been demonstrated to be the way to provide care in this environment where physical contact is limited. But into the future, it's also demonstrated to be the preferred way of delivering a service. Even if you could give physical contact, remote contact becomes always the first point of contact before you then tell the patient to come in for a physical inspection. You can actually do a lot of the work remotely, and that's limit the physical traffic, limit the expenses for both yourselves and for the patient, and well, I guess also limit the traffic on the roads, and also be able to reach those patients that would not necessarily be in a position to travel immediately. Because you can actually serve a patient who is actually at work in the office. So there are many reasons why telemedicine becomes a very ideal solution. And we have that as an offering.
Is it just me who is having challenges to hear Chance more?
I can hear him. I think we're okay on this.
I can also hear him.
Yeah.
Okay. And maybe I can also point out that you have been enabled to record this presentation so that you probably can always refer back to it internally. So we can go ahead and record this presentation as we do it. Let me know if I can proceed now.
Yes, please proceed.
Sure.
Okay. All right. So that is telemedicine. And then our next innovation is a medical insurance system. I'm pretty sure you already have this as it's absolutely critical, obviously, to have a system that runs the benefits management process. So we have an end-to-end solution for managing the membership, subscriptions, benefits, claims, and electronic claims processing. As I already hinted, with telemedicine, the claim is processed electronically because it's an electronic process. But even those providers who are not necessarily on your network, or who have seen patients physically without telemedicine, they also can submit their claims electronically. So let me just show you the backend system that you use as a funder, which enables you to then manage your membership. So just quickly, this is the user interface for the system, showing here your members record, and here on the right, the list of this particular members visits. In other words, the claims that they submitted. And you can also see the status of each line in terms of what was claimed, what was awarded, and what benefit was drawn from. That way you can keep track of the benefits and consumption of benefits by your membership. And you can quickly also view a benefit summary of all the benefits that this particular member has access to. Now, obviously, I'm just picking a few features, but really there's many features. Each of these products would take several hours by itself. So for example, I'm just showing you an overview of the benefits for this particular member, which shows the limits, the global limits, the balance, and what is available under each benefit. And this is a package which offers multiple benefits, actually over 30 individual benefits that this particular member is entitled to, and you can actually see the status of the usage of the benefits, which obviously is valuable. Then, of course, from here, there's many things to enable you to set up your funds, to import data, to manage your membership in terms of reporting, for billing, whether it's corporate billing or individual billing, claims reports for your accounts where you pay your claims and manage payment batches and your electronic claims processing, and then for management reports and other reports. I'll just quickly show one or two reports here, just give an appreciation. Say, for example, you want to do a benefits utilization overview so that you can get an insight into how benefits are being utilized. So you can quickly draw a report that shows you that this benefit, for example, day-to-day outpatient medication, number of claim lines. By the way, if anybody wants to quickly shoot a question, it's okay with me. You can stop me anytime. So this for example gives you a breakdown of how benefits are drawing down from the overall pot or from the overall society's reserves. You can see the total value, any shortfalls, average claimed, total awarded. But there's actually many of these reports. Fund consumption, claiming trends by age, claim analysis by provider, claims analysis by members, claims analysis by diagnosis or by specialty. For example, you can quickly get a breakdown of which discipline or specialty is claiming more than others. Like in this case, you can tell, they compare things like ambulance, anesthetists, or CT, dentals, all that. You can see how many claims come from each. We can also filter this by time or by specific fund as well. Of course, this covers all the different specialties that would be registered with you. There's many of these reports. You can also even interrogate things like fund utilization by plan or by package, or benefits rejection and reasons overviews. So that's a quick overview over the medical aid or medical insurance administration system. So it covers just about everything you need to manage your medical aid. Then I'll quickly go to the next innovation, which is laboratory information system. So this one, it enables, it is for your service providers or laboratories. It enables them to process samples and provide results, and thus be able to take care of our investigations requirements, and also to do validation of lab results. For example, in this currently, there's a challenge of validating COVID results, for example, and this system takes care of all that. In fact, it's actually already being used by airports across the globe to validate results. So I'm just quickly showing you here a patient with test results. Which are then made available electronically to the requesting service provider or the requesting doctor, and to the patient electronically as needed. So this, for example, how the results would be previewed and thus printed, and therefore availed on print or on electronic, whether it's email. But we also have a portal that I'll be showing you in a moment, which avails these results. So that's the lab information system. So I want to now go to the next innovation, which is a hospital information system with electronic health record functionality. So bear in mind, there's actually a lot I could cover, but I'll try to just to be high level as much as possible. So just quickly look at system for managing patient records. This is for your hospitals. As a funder, you'd ideally provide this as a platform where all your service provider network can just plug in and manage all their patients, your members, that is. So this, for example, it's got all it manages all the keeps records, the clinical records from the vitals, vaccination records, doctor's notes, all included, records of investigations, in terms of lab results, and then you also have records of obviously the diagnosis with multiple diagnoses or with ICD-10 code. The whole ICD-10 code library is already preloaded into the system. And then you have things like treatment plan included in the system as well. With management of stocks, the prescriptions also included in the system, the admissions, records, and the various registers which are required in a big hospital. So this system actually takes off sizes of facilities from, say, a GP's rooms to a hospital with over 450 beds. Or any size, basically. It is very, very comprehensive and very scalable. Then you have things like referral letters, sick notes, and of course your billing, where the overall bill for the patient is then recorded with the different tariff codes and the full bill, and attachments can also be added to it. And of course, claim forms or invoice or statements can be printed, and you can also receive the patient for cash payments or other payments, perhaps for co-payments to the medical aid payments. So that's a very, very, very quick overview of the hospital information system. It's integrated with the funder so that before a patient is seen, it actually verifies the status of benefits for the patient, just to give assurance to the health service provider that there is benefits that will cover the treatment that they're about to give. All right, so the next innovation I'll show is a managed wellness program. So the wellness program, this is where your members can enroll and they can keep track of, firstly, they get knowledge. So I'll just quickly give you an overview. Like this one, this wellness program is, we call it timeless wellness. It covers the problem of longevity or long life. So you can see it's modules here. It covers the problem of long life. It's quite a bit. The problem of aging, and then talks about the solution, science and nature, and then how the body can be recycled. But all this based on science, obviously, talking about autophagy, things like intermittent fasts, and then debunking the myths around aging, and what we call the secret to longevity, and then educating your members on eating and what happens to the bodies when they eat or don't eat, and also some basic biochemistry, and then educating your members on when, how, and what to eat. Obviously, this is critical, right? So the whole idea is to reduce the probability of sickness among your members, because when they don't get sick, you can maximize on the subscriptions for other purposes because there's less claims. And because of the multi-pronged approach, it means that you can also develop customized subscription models for your members. For example, if you know that this particular member's lifestyle is low risk, you can also give them incentives, maybe cashback plans, or you can lower their subscription rates. But all because it's a managed ecosystem. You pretty much have their whole life within your ecosystem. Therefore, you're able to actually help them to reduce the sustainability and susceptibility to sickness, which then reduces the claims and thus optimizes your management of the benefits pot. So
just if I can just add on that, Chancellor. I just want to give an example of how a wellness program has been able to do wonders in a country like Zimbabwe, for a country like for a business like Econet. So, for instance, all Econet employees were asked to join a wellness program, and because of this solution, we're able to monitor who is taking part in that wellness program, and we're also able to see their how involved they are in the plan, and over time the staff are being given incentives because we're able to monitor. We can see that John, every single week, he's logging into the wellness program, and you can do the same for your members, where you try to monitor the members who are active on your wellness program, and you try to provide incentives to them, whether it's reduced premiums or even just other bonuses that you can give them. Over to you, Chancellor.
Okay, thank you so much for that. So in fact, I'd actually, I think I've utilized my 20 minutes. And
no, Chancellor. The 20 minutes was for me to just time you. I think what we still have time.
Okay.
Can you please go ahead and go to the medical switch? I think that's something that with Mr. Chikoti we had discussed thoroughly, and he was very interested in that. So spend more time on the medical switch.
All right, so I pretty much covered at the back of the medical switch. So now, a medical switch basically means that claims are processed electronically. So let me just go back to what I'd showed you earlier. So in your backend system here, you're actually able to, all these claims that are being received, they're all coming in electronically. You don't actually have to capture these manually. So the switch is a system that operates in the background, integrating all the different points of care, all the points of value chain addition. So where it's experienced by the different players in the patient's journey in different ways. And the user interface I showed are the front end manifestations, while the switches are operating in the background, integrating them all, enabling you from the funder backend to see the activity from the front. In short, that's what happens, and that's how it works. I want to find a report that you also can run. So for example, this actually shows you, this is a report that you're actually able to pull from the funder's backend, and this is taking advantage of the medical switch. Let me show you what happens when a service provider is say for example they want to treat a patient, right? So the first thing, they want to capture a patient, and these are the different funders. So say for example this is your funder, and they put a membership number. Okay, so I just got an alert here that the meeting will be ending in a few minutes. So I suppose at that point we will be ending and then starting again. Is that correct?
Yes, I think we should do that.
Okay. So in real time, what just happened is that the system actually, this is happening at the doctor side, and the system just connected with the funder's backend system and checked and verified the plan that this member is on and the full name, and I to even confirm that the date of birth entered is not valid, and what the national ID is, gender, join date, the status is active, the benefits date, from this date the benefits have been availed. So right away the service provider is assured that this patient has benefits for a long time, so they're no longer they're no longer affected by waiting periods for the different services. And this is enabled by the medical switch, which is operating in the background. The switch is a connection between the service providers, the funders, the patient, and any other player in the value chain. In fact, it is so broad that it even covers say, for example, researchers that are needed to perhaps help with optimizing your packages, actuarial researchers, they're able to draw down a lot more from this. It comprises of APIs, which are connection points, which different systems then connect to. So it's like a component in the background, which you only experience when you plug in, like I just did right now. That's regarding the medical switch, and it is highly customizable. Just about any other system can actually speak to it, can connect and be able to make various inquiries into the background systems, which are all plugged into the ecosystem. So that's a little bit about the medical switch. There's a lot that can be showcased, but it's all done by plugging in systems into the backend.
Yeah, just to add on what Chancellor has said, I think in terms of the user journey, it goes like this. Henry goes to City Center Clinic, and from there, City Center Clinic needs to verify that Henry indeed has a valid medical aid. So they log in, and all these systems is showing you from the back end, but it will be customized and developed into an app. But it can also be customized and integrated with your current Mazim app. So basically, anyone who is a member, they go to any facility, they're able to, the provider is able to verify instantly whether indeed Henry has a valid membership. And from there, the system connects to your system in terms of the hospital management. So you're able to see that Henry indeed went to City Center Clinic, and from there, he had a consultation, and from there, he went to the lab, and from the lab, he got his prescription, and all that is happening in real time, and you're getting that data in real time. So there are no leakages. All the fraud that is happening with the different providers gets cut off because you're in control of your system. But more importantly, I think in the day that we're living in, with innovations like telemedicine, where people don't have to go to hospitals anymore, they can actually just they can arrange an appointment with the doctor, talk to the doctor in real time, get a prescription, and you're also able to monitor that. So thank you.
All right, thank you. So I think I've covered the bulk of it. Okay, actually no. Let me just quickly show you also the patient's portal as well. Okay, so just for the rec, I think we now have 5 minutes.
Yeah, so what I'll do, I'll create a new link because I think we're only given 40 minutes. So I'll create a new link and send it to you, Mr. Chikoti, in literally 2 minutes, and then you can continue the meeting from there. I'll excuse myself because I have another engagement, but my team will lead on that, and also Robert, who is on the call, will be able to make follow-up and
Sure.
have a fruitful discussion.
Sure, Henry. Proceed to create the link.
Robert, are you talking?
I know, but I was wondering, in case maybe we can utilize the few minutes, if you have any need for clarifications or questions, whilst we are creating the new link, you can proceed, sir.
Yeah, my colleagues, if you have any questions, obviously, because we're rushed for time, I think Henry didn't give a background of who you are as a beginning, just to understand what the organization is, what it does. It would help.
Chance more?
Okay, so hello, confirm you can hear me.
Oh, yeah, we can hear you, Chancellor.
Okay, so we are a technical innovation company. We build solutions, and we've been doing the building of solutions for a while, for a long time. As I shown you earlier in the beginning, over a decade of solutions that have actually been taken up in the markets. And what we do is, while we have pre-built platforms and solutions and technologies, we also build custom systems, mostly for healthcare. While we have a small footprint outside healthcare, as in education, we've mostly specialized in healthcare, where we've been building solutions for the different players in healthcare in different countries. By far, the largest footprint we have at this time is in Zimbabwe, Botswana, and a bit in Zambia. And we also have some footprint in the US as well. So that's a quick overview of the organization in terms of the footprint, in terms of the background, in terms of our specialty, the areas where we can say that we can confidently discuss solutions. That is our jurisdiction. I don't know if that suffices for some background about the organization.
Yeah, I think a good summary for now. We may continue.
And sorry, if I may also quickly just add, I think in terms of our working model, what we normally do is to identify the problems, whether it's with a funder like yourselves or a service provider. We identify the problems, we look at your systems where you are getting maybe overclaims or you're not making savings. We come up with solutions, and we agree with you in terms of how we can work out in terms of coming up with a commercial agreement. Should we